Hello, welcome back. Today in this video we are going to learn a typical rib. There are 12 pairs of ribs. The ribs can be classified into true ribs and false ribs. True ribs means they are connected in front with the sternum through costal cartilages, and false ribs are the ribs which are not connected with the sternum. So they are known as the vertebrochondral ribs. These are 8th, ninth, and 10th ribs, and there are floating ribs also. 11th and 12th ribs are known as the floating ribs. Their anterior end is free, and the ribs can be again classified into typical ribs and atypical ribs. Typical ribs having common features, and there are atypical ribs which does not have which have some extra features. So they are first, second, 10th, 11th, and 12th ribs. Come, let's see the common features of a typical rib. So here you are seeing a typical rib, and it's a curved structure and it is angulated. It has got two ends, anterior end and posterior end. Identify the ends of the bone. Let's see the features of ends of a bone. You can see here, just look at here. This is one end. You can see there is a concavity at one end, and the other end you can see some process and some facets are there. Okay, so the part of the rib where we are saying this structure is known as the head of the rib. This is the head of the rib or the posterior end of the rib, and the part where we can see a notch like process here, notch like structure, this is the anterior end of the rib. So identify the anterior and posterior end of the ribs. This anterior end is articulated with the sternum through the costal cartilage, whereas this posterior end is articulated with the corresponding vertebrae. Right? So here we have the anterior and posterior. Now look at its borders. It has got two borders. There is an upper border and lower border. Now just feel the two borders. I told you there are two borders. If you feel this border, you can see one border is rounded and the other border is sharp, and you can see actually there is a groove. This groove is known as the costal groove. What is that? Costal groove. So this sharp border and the costal groove is directed downwards. Okay, so the features are: identify the anterior and posterior end. Now feel the upper and lower border. The upper border is rounded and the lower border is sharp with the costal groove. Okay, so this sharp border with the costal groove is directed downwards. So after identifying these features, hold the rib in such a way that the anterior end is directed forwards, the inferior sharp border is directed downwards. So now you can see this rib belongs to which side? So this rib belongs to right side. We already identified the posterior end. I told you posterior end has got a head. This is the head of the rib. Just behind the head we have a neck, and there is a tubercle. So the posterior end of the rib has got head, neck, and tubercle. And just look at the head. Examine the head. What you can see? You can see there are two facets. The head of the rib has got two facets separated by means of a sharp crest over here. There is a upper articular facet and lower articular, and you can see the lower facet is larger. So to remember, we say lower larger articular facet, lower larger articular facet, and upper smaller articular facet, separated by means of a sharp crest. And this lower larger articular facets articulates with the corresponding thoracic vertebrae. And if you see the tubercle has got two parts. Okay, there's an articular part and non-articular part. This articular part is medial articular part, and lateral non-articular part. So this medial articular part is articulated with the costal facet of the transverse process. So I told you this lower larger facet articulates with the costal facets on the body of the vertebra, whereas this medial facets on the tubercle articulates with the articular facets on the transverse process. Now let's articulate the rib with the vertebra. So here I am having the typical thoracic vertebrae. So here you can see the other video we have already seen that the lateral surface of the body of the thoracic vertebrae have facets. So we have superior larger facet, inferior smaller facet. Okay, here they are getting articulated. So this is how it is. The lower larger articular facet with the superior articular facet of the corresponding vertebra, it is articulated here, and we have the other articulating part over here. So this is how it is. I will show you. See, we can see here we had the articular faces on transverse process, which articulates with the articular face on tubercle, and the joint formed here is known as the costo-transverse joint. Costo-transverse joint, and here between the body of the vertebra and the head of the rib, this is known as the costo-vertebral joint. So here we have the costo-vertebral joint, and this is the costo-transverse joint. Costo-vertebral and costo-transverse joint. So here you can see how this costo-vertebral joint is formed. Then I already mentioned that at the head we have two articular facets. Between there is a crest. So this crest actually it lies opposite to the intervertebral disc. Intervertebral disc. Okay. So there is a ligament which is attached to the head with the body of the vertebra. We call it a triradiate ligament. Triradiate ligament. Okay. Then the constricted part just lateral to the head is known as the neck. The neck has got two borders. There is an upper border, lower border. There is an anterior surface and posterior surface. So here is the anterior surface and here is the posterior surface. Shaft of the ridge is curved, bent and twisted on itself. It has got two surfaces. There is an external surface, internal surface, two borders. We have already seen the superior border and below we have inferior border. That was some of the features of a typical rib. Hope you like the video. If you like the video, please share it with your friends and give us a thumbs up below. If you have any suggestions or doubt, please do comment below. Thank you for watching.